I think there are 2 or 3 things matter. And the Kerala example, as illustrated by Dr. Jayadevan, is really symbolic. It's the confidence of the health system that matters. It's the hospital preparedness of the health system that matters. Now, I'm not a medical specialist, so if those from the medical profession, for instance, had said that no, we are not confident, we are on the defensive, then I would have changed my argument. But in this case, they're clearly saying that their hospitals are, first of all, not packed. The number of ICU beds, including oxygen and oxygen beds, are not as much under load as they were perhaps earlier. And we have to remember, I know that there are Bugattis and Bentleys that are being sold like there was no tomorrow, but there's a very large part of the economy which is catering. And we have to think now, as we stand or sit in July of 2021, at the end of the second wave, on how to get the economy back on track. So and obviously we have to defer to and work with the medical profession and those on the front lines. But we have to, and you use the example of United Kingdom, a country like Singapore, much smaller, or even Australia, are all talking about opening up and trying to live with the virus. We have actually much less choice than Australia and Singapore do. I mean, we have to get this economy back on track.
Because we don't have their economies. We don't have their economies. We don't have
exactly. And Kerala has one more element which I think is very critical, which is literacy. Now, I don't know to what extent literacy relates with the ability of the administration to impress upon people the need to, let's say, wear masks and sanitize. But I'm sure it should work better than states, let's say, where literacy levels are low. So Kerala, I think, is not an example of how things are going all right, but actually, I think, an example of how the economy should be now, or it's time for the economy to be pushed back into action. And even as we think about how to manage the medical side of the problem, which might be more acute in other places across the country. But I think now we cannot have a discussion in isolation of the economy. We need to think about the economy and livelihoods at the same time as we think of the medical challenges that we are facing or will face.
We know that Kerala officially has reported around 30 lakh cases, which is around 10% or around 9% of their population. Through Zero surveys, we know that for every confirmed case in Kerala, unlike rest of the country, there were 5 to 7 asymptomatic or unconfirmed cases. For rest of the country, this number was around 25 to 30. So essentially, Kerala is picking far more number of cases than the rest of the country, which picking. For example, at national level, we have around 3 crore cases, but we know for every undetected cases, if there are 20 to 30 cases, essentially around 70% of India's population by now might have been infected, asymptomatic or officially reported symptomatic cases. That number for Kerala is likely to be somewhere, if we multiply 9% of total population, which is officially reported cases, by 5 or 7. So it will be around 50%. So even with the number of cases being reported, the actual population which might have been infected, developed natural antibody through asymptomatic or symptomatic infection, might be somewhere around half of the Kerala population, far below India's population. And that's why they are still reporting the cases. As Dr. Jayadevan also said, other thing, that Kerala is doing really good contact tracing. Essentially, they are identifying a confirmed case and then going to the person in their family. And that is the reason they are picking more number of confirmed cases or asymptomatic also. Because in contact tracing, you pick up asymptomatic cases, which you do not pick up in other states, part of the country where contact tracing is not good. So Kerala is following a natural phenomenon. Nobody can stop the transmission of virus that well. But Kerala is picking up well on this part. So the last part of this is that while we need to pay attention on all the indicators, they have a value, test positivity rate, contact tracing, all of those things. But important indicator is that how well health system is performing. What is the case fatality rate? And Kerala, in spite of all of this, has achieved 1/3 of the case fatality what India has reported. So I personally think that while the measures and the efforts should be continued, it is definitely not a reason to worry. Because it still has a susceptible population. That's why it is likely to continue to report cases. It's, in my opinion, honest reporting, better for performing system. And as long as health system is not burdened with it, it is perfectly all right.
We've seen, we've debated on the different variants, different waves, their timings, what will happen in the third wave, and so on. What's the only fact that we all know for sure is that 2 doses of full vaccination for COVID is the only thing that can prevent severe disease and death. And that's the point we have to reach as soon as possible. And we started in great gusto 3 weeks ago. I think we went up on the 21st of June, we went up to 80 lakhs a day. But the numbers have been steadily declining, and that's really of concern. While the government has assured us that there'll be enough vaccine stock to vaccinate all adults by December 2021, that's only going to happen if the numbers are approximately 80 lakh to a crore of vaccine administrations a day, and we are nowhere near that. We've actually dropped on a 7-day average has dropped from 3 weeks ago to 60 lakhs per day to just about 39 lakhs per day as of yesterday. So obviously we have to ramp up those numbers as soon as possible, and that's really of great concern.
And given that there's still no clarity on vaccine supply, what are we looking at, Arvinder, according to you? We're all acting pretty much as if this pandemic is over. There's a lot of theory bazi about third wave, but nobody quite knows for sure.
Well, I think that initially in May, we were told that there'll be 2.16 crore doses of the vaccine available by the end of the year. And then this number was unfortunately revised to 135 crores, I think 2 weeks ago. And I saw notable omissions of the Genova mRNA vaccine and also the Novavax. I don't know why those were not in those 135 crores.
TPR for our viewers, very briefly, if out of 100 tests that are recorded in a region, how many are positive for the virus? So the TPR, it depends. It's a basket of multiple tests. For example, a test can be done in different settings. You could do a TPR standing on the road and catching 100 people on the road and do a test on them, and then that number will be terribly low. You could stand in an airport and screen all the incoming passengers who've already boarded the flight knowing that they are COVID negative. Their TPR will be very, very low. But you could go to a hospital and find out if among all the people who have symptoms of COVID-19, if you do tests on them and their contacts, the TPR will be high. So the point I'm making here is if you do testing which is basically targeted, the total percentage of positive tests will be higher. That does not necessarily mean that there is more disease, even though there is a loose correlation between the two. So that's the first difference. The second difference is that in terms of how the pandemic spreads across different regions, if you've noticed, Kerala's curve has been quite different from the rest of India. Kerala's curve never really took off in the first half of 2020. It took a steady climb with the. I wish I could show the graph here. It is. I have it on my laptop. But basically, the curve started a slow climb all the way till almost like it reached the peak in October, and then it came down slowly. And then it took another peak in January when we reported from here saying that, look, there's another peak going on. That is the third peak in January. Right now, Kerala is riding its fourth peak. And the cases have really come down in terms of what we see inside hospitals. Our ICUs beds are becoming available. There are free beds available. People are not struggling. People are not dying.
So you're saying the cases are dying, but the healthcare system is not under pressure?
It is definitely, in fact, the healthcare system almost never came under pressure. I think the lockdown came just at the right time. The fourth wave, or what we call the second wave in general in India, that was huge in Kerala, like in other parts of India as well. But that was primarily because of the Delta variant, which is a super fast spreading virus.
So Kerala, actually, just half a minute about Kerala. I think they planned very well. They anticipated what they have, and they anticipated what might happen. My own suspicion is, Rajiv hasn't said that, Kerala will begin to see steady but slow decline. I think they go in a decline phase now, but their decline will be real and slow and steady. I want to demystify the earlier comment about your vaccine, if I may, which is from 216 crore to 135 crore. And is that 135 crore real or not? And I've said it on your channel before, that whole of July, I don't think there is any stock. I've always argued, even if there's one vaccine with the producer, it should be in somebody's arm within 72 hours. So actually, we will see whole of July, not more than 40, because there are no vaccines right now. Now, whether it's government or you and I, that's what you've got to live with.